right, hi everybody. Hope you can hear me okay, and hopefully you can also see the screen and the slides. Thank you all so much for taking time to participate today. Again, my name is Kristen, and I'm here to kick off what I hope is going to be this really interactive series of workshops to provide you with helpful information and discussion around how you can feel a lot more comfortable and more confident, not only responding to calls from reporters, but also using media more proactively as a tool to accomplish your mission. As Katie said, we're intentionally keeping these sessions short, 30 minutes, so that the information is served up in more like bite-sized chunks, hopefully making it easier to absorb and less time for you on the phone and in front of the computer, because I know how busy you all are during this very difficult time. And again, to reinforce what Katie said, in addition to these Media Monday sessions, I am available anytime to answer your media-related questions, help you with writing or editing, help you find or respond to reporters in your area. Really, whatever you need help with, just give me a call or an email. So today we're going to spend about 10 minutes talking about the big picture of what we mean by strategic communication and how engaging in media relations can help propel your program and increase your impact. And then we'll leave plenty of time to share your experiences and answer questions. Oops, hold on. Here we go. Thank you to those of you too who were able to complete the survey Katie sent out, I think last week. In a nutshell, these key takeaways from the survey are going to help inform what we're covering in these workshops. These charts are a little bit hard to see. I know they're blurry and small, but I'm going to go over the key findings from the survey. I think that one of the biggest ones, most important finding was the biggest need that you guys named or challenge that you face is a lack of staff, closely followed by a lack of funding, and then tying for third, saying you're not having enough volunteers, and also a concern that you're not being taken seriously enough. And today, again, I'm hoping that I'm going to show you how using media as a channel for communicating about your work can help position you to attract more funding, which can in turn allow you to build your staff and your volunteer capacity, which in turn can expand your reach and your impact and your clout and your influence. The other, I think, really important finding was that you're 100% unanimous in agreement of who your priority audience and stakeholders are, and that is the residents and families in long-term care, followed by your fellow Ombuds program staff and volunteers. Your clear focus and deep understanding of the stakeholders you're serving is actually a real advantage. A lot of groups I work with, they might list 5 or 6 or more categories of people when they talk about who their audience is, which makes coming up with a clear message more challenging. In addition, in the survey, we found that most of you felt pretty comfortable and confident about your ability to talk to reporters, but at least a third of you expressed some concern that you were not super confident. You're not super confident responding or proactively reaching out to media. And over half of you said you don't have a great up-to-date contact list, for example, for media outlets and reporters in your area. Most of you said your most frequent online communications tool was your website, but you also said that your primary ways that you communicate with your stakeholders are phone calls and in-person meetings and your newsletter. You also let me know that you'd like to learn more about how to deal with reporters who might mischaracterize you or get the story wrong. And you want to know more about the do's and don'ts when dealing with the media. I'm hopeful that you'll get that information, skills, and tools that will help you boost your confidence to execute effective media relations that will reach your audiences and in the long run, boost your staff and volunteer capacity and funding. And in the coming weeks ahead, we're going to take deep dives on all of these topics. So today, again, we're going to focus on how strategic communications can be used to effectively reach and represent your stakeholders, raise awareness about your program, and leverage that increased awareness into increased support, increased funding, increased staff capacity, and increased clout to accomplish your mission. Strategic communications can enable your organization to create and distribute communications that, while they might be different in style and purpose, have an inner coherence. This consistency can help foster an echo chamber, kind of an echo chamber effect that reinforces your message. At a minimum, it can help prevent contradictory, confusing messaging across your platforms. We will get into this a lot more when we drill down on what is your core message. How can you get it out in our upcoming sessions together? Today, I just want to kind of put on this broad concept on your radar screen and one of its primary tools, media relations, which is a cost-effective way to increase your impact and achieve your mission. We're not talking here about advertising or traditional marketing, both of which can be very expensive, and if you ask me, they can have dubious results. In my world, we call this strategic media relations work earned media, not free media, because while it's not expensive, like paying for ads, it does take time and effort and a thoughtful approach to pay off. So, how can working with the media help you accomplish your goals? You've probably heard the expression, if a tree falls in the woods and nobody hears it, does it make a sound? Ombuds for long-term care programs do amazing, essential work to ensure the voices of residents are heard. You protect the health and well-being. You help resolve the complaints and conflicts affecting our society's most vulnerable populations. I would venture to say that outside of the kind of community that you work with, not enough people are familiar with state ombuds programs. Your work should not remain invisible. It should not be invisible at all. And this public health crisis we're going through is providing an opportunity to educate the public and the governing bodies about the important role that you play. Earned media, in other words, news coverage, whether it's a newspaper article, a TV or radio story, when it includes your voice and educates hundreds of people or thousands or tens of thousands of people about why your work is critical, that's great bang for your buck. You've also probably heard the expression, there's no such thing as bad publicity, which is often associated with P.T. Barnum, the 19th century American showman, or this expression, the only thing worse than being talked about is not being talked about, which was attributed to Oscar Wilde. Now, this perspective is certainly debatable, and I can think of a few folks who might disagree that all publicity is good publicity, but in your case, I would argue the more coverage of ombuds and your role and resources, the better the outcomes that are possible for residents and families. This diagram to the right here, which again, I hope you can read, it's kind of small and blurry. It shows the circular kind of reinforcing effect that media coverage can have on your organization and your impact. You've probably also heard the expression, killing two birds with one stone. When your message breaks through to your target audience in a compelling way, not only does it increase awareness and support for your program, it can increase your power, your influence, and your credibility when it is time for you to make an ask. Whether that's a call for more funding, a call for more volunteers, or a shift in policy at the facility, local, or state legislative levels. Starting with that green circle dot kind of around the 2 o'clock position called news coverage, the more ombuds that are in the news, the more the public is aware and informed about your work. And the more informed people are, the more likely they are to be supportive and engaged. You're going to be able to expand your base of supportive and engaged stakeholders, which gives you, in turn, more credibility and influence, setting you up for greater impact and success, again, when you do ask for increase in funding or more call for volunteers or seeking changes in policies. And then when you're successful in those asks, it just makes your program more effective, your impact even greater, in turn, again, positioning you as a go-to resource for the media. And it just builds on that cycle over and over. The good news is that media relations is actually not rocket science. It can be intimidating, but I'm here to help you realize that it's pretty easy, and you're halfway there. Step one, which is really very important, but you've already done, is to determine your audience. Or another term for that, I think that might be more accurate, is your stakeholders. Your highest priority audience or stakeholders are the residents and families. You've already figured this out, and you just want to be as specific as possible when you're thinking about who you're trying to communicate with. Try to gain a deep understanding of how they get their information. What do they care about? Who do they trust? For example, a resident or a family member might get their information from materials in the facility or a volunteer, whereas a policymaker, as a different audience, might turn to a lobbyist or turn to your office for information. And they may also hear your message through mainstream media. To leverage media and other communications tools to connect with your audience, to share information and engage them in ways that help you accomplish your mission, you need clear, effective, and credible messages. Different messages and possibly even different messengers may be necessary to effectively reach different audiences. For example, your message to residents and families will likely be a little different than your message to a federal agency or a legislative body. In many cases, you yourself are probably the best messenger, but sometimes someone else in your organization or from a population you serve might be the right person. For example, a resident or a family member might be the most credible, effective messenger to give that firsthand account of the impact of, for example, visitation restrictions during this COVID crisis. Third, think of communications tools as channels to deliver your message, and also to engage in two-way conversation with your target audience or your stakeholders. Some tools are great for simply broadcasting your message, thinking about like your website or your newsletter. Others are useful at engaging in dialogue and getting feedback. Other than your websites, the tools you mentioned in the survey that you used most for communications were meetings, phone calls, and newsletters. You can augment these tools with, again, media relations, with traditional media like newspapers, wire services, online news, TV and radio stations, magazines. And in another Media Monday session, we'll go over the importance of having that good, up-to-date press list at your fingertips. I'll share an example of how that might look. Of course, you can also utilize social media tools like Facebook groups, which is also a topic we could explore further down the road. With that, I am going to pause and, give us a chance to share stories. I don't know if anyone had a chance to think about this or has a story they'd like to share. You'd be willing to talk about how you're communicating with your primary audiences right now, the residents and families, especially when so many of your usual ways are restricted because of the pandemic. How are you successfully reaching your audiences? Who's doing the communicating? What's your message? And what tools are you using to reach them? I will also, I don't know if I should stop sharing the screen. And I can also, I don't know, I guess I'll just stay on here. Is everyone off mute? Can you speak using your mic? I could kick us off by starting and sharing a story that is from Washington State, working with Patricia Hunter here just a couple of weeks ago. Patricia was interviewed by a local TV station about a family that reported they were being prevented from having even a window visitation with their loved one. This story helped communicate the message around our concerns about resident rights to visitation, And it also provided leverage to ensure that facility was complying with the rights of residents and families to communicate and to clarify what their policy was. It also put this issue on the radar for the public and on the radar for other reporters and decision makers at the state level. Just an example of how saying yes to that interview kind of allowed us to amplify the concerns of residents and families, and put it in the spotlight of the media, getting the facility and policymakers to pay attention and remind stakeholders of the role that the ombuds plays. Does anyone else want to share a story or ask a question about the material I just presented? I can't hear anybody. Is anybody talking? Let me see here. Katie, can you hear? I can't hear you, Katie. Katie?
Can you hear me now?
Yeah.
Sorry.
No
I
problem.
was just saying, if anyone has anything that they want to type into the chat, I can read it out loud if you can't say it, if you don't have a microphone. Or if you have any just questions for Kristen, just feel free to speak up and we can talk about it.
Yeah, I think there is a message there in the chat that said, if you don't have a list of media, that might be a good job for volunteers. Yeah, I agree. Yeah, absolutely.
This is Susie
Are
from
there
West
no
Virginia.
questions?
I don't really have a question, but I did want to say thank you to Kristen. I had the opportunity to listen to you on one of our calls the other week, and I did get a request from a local NPR reporter to do an interview. And I have to say, that's dealing with reporters is one of my least favorite parts of this job. It's just slightly above a root canal.
Oh.
And it depends on the day. But based on the information that you had given us, it sort of helped me reframe my attitude about this. And I really was able to look at this as really another resident service. And I want to be good at providing all the resident services that I provide. So when I looked at this as another resident service, it made me realize that I have some room to grow here. So I really appreciate this opportunity and your expertise helping me grow to provide a better resident service than what I've been providing in the past.
That's awesome, Suzanne. Thanks for sharing that story. I mean, it's really, it's like, first of all, you guys don't need more work to do. Secondly, it can be really intimidating to deal with media. But if you shift your attitude a little bit, as you've just been given another tool in your toolbox, kind of a megaphone, to help make that voice of the resident even louder, and make sure that, I don't know, I feel like helping you get the word out that you're available as a resource, use the media, don't let them just use you.
So Kristen, I have a question. If you were to offer one piece of advice when talking to a reporter, what do you think that would be?
Gosh, I mean, I think just always think about what you know for sure. Talk about what you personally know, your personal experience. You're always safe on that ground. When you're talking about firsthand experience and firsthand examples and yourself and what you know from your years of experience, you're on really safe ground. And the other thing is, honestly, most reporters are not out to get you. There are some that maybe are more difficult to deal with than others, but most reporters are simply, they're trying to do their job. And and look for a story, and you're a resource that they can go to. So know that. And again, if you're not in a live interview situation, which most of the time you won't be, you always have a chance to say, you know, hold it. I want to take that over again. I don't like the way I answered that question. I'm going to start over. So you always have a chance to say, I'm going to redo it. Please don't use what I just said, and do a do-over. And even, okay, somebody had asked, what do I do with when a reporter has totally gotten it wrong or mischaracterized what I said? I mean, that may happen. And you have every right to correct misinformation, to call that reporter up and say, you know, here's what you got wrong. And you try not to get in a fight. Don't call screaming and angry and speak to the managing editor yet, but just try to make sure, just appeal to their sense of, I want to get the story right. Most reporters don't want to misrepresent something either. So just, you know, don't be afraid to call them on it though. Go ahead. And I think there was a raised hand. Yes.
So, Kristen, one would assume that many of the reporters are not that familiar with the ombudsman program.
Yeah.
Until you know, a state ombudsman has established a relationship with them. So how much back history, or how much, you know, can I just, before we start answering the questions you have, can I just tell you a little bit about the program? How long, or what should we have that prepared so that people are understanding who we are, so that it just makes it a little bit easier to answer the questions?
Absolutely. I would actually start with, hey, do you know about our program? Can I tell you a little bit about our program right from the start before you answer any questions? Use every interview as a chance to basically be a teacher. Like, this is who we are. You know, it doesn't have to be a 20-minute speech. If you could get it down into a, you know, a paragraph, a couple of sentences. This is what our role is. This is how we were established. And next week, we're going to work on that. What is your core, kind of, what's your elevator pitch? If you got into an elevator, Ben, somebody said, what do you do? What's the ombuds office? And you have 30 seconds before they get off on the next floor. How are you communicating what your program is all about? So yes, have that ready and use every interview as a chance to educate, kind of Ombuds 101.
Kristen, this is Sally from Michigan, and I think I've done more media interviews this last 2 months than I have in my whole life. But the one thing that I wonder, there are times that, based on the way I've been approached by someone from the media or just the initial questions, they're digging for information that I can't either verify, or it's information that isn't helpful and I don't want to be part of that story. So is there a way to gracefully say no thank you to an interview without being quoted as no comment or they weren't reachable?
Yeah, that's a good point. Yeah,
like
we're going to dig into a lot of tricks and tips for kind of pivoting away from questions that you either aren't capable of answering or don't want to, or it's the wrong angle, to stories that you do want them to focus on. And then sometimes you just outright don't want to be a part of that story. So it's absolutely okay to say, I'm not the best person to speak to about that. You could give them another person to call and talk to if you have that in mind, or you can just simply leave it at that. I'm not qualified to answer that. I can't verify that. You know, that's not my area of expertise. I don't have access to that information. Definitely don't feel pressured to go into areas that you don't feel comfortable with or not the authority on.
Thank you.
Does anyone else, I mean, you've all probably been getting a lot of calls and doing a lot of crisis communications these last few weeks. Does anyone else have story you want to share about something that has been challenging, or something that's gone really well, a time that you've done an interview or reached out to a reporter and it's been really helpful?
This is Jenny in Missouri. I didn't do the interview, but one of my regional program staff did an interview in the news. It was with kind of a local news station. And they actually went on site to one of the facilities that was having a parade. So the ombudsman himself was in the parade, and then, you know, all the family members and stuff. So I really thought that was a good thing, because it showed, you know, they interviewed the regional ombudsman and she got to talk about the program, but it was much more positive. A lot of times it seems like they're coming at us with, you know, like they're upset with the nursing home. They're trying the most to get it. That's their angle. And we're put in a position where we don't want to defend the nursing home, but we also don't want to, you know, throw them under the bus either.
Right.
So that was nice one to have something positive.
Great. Yep. Good example. Yeah. Just this morning we had an interview with somebody who, you know, you can imagine reporters are still kind of digging into how this all started here in Washington State at Life Care in Kirkland. And one of the ombuds volunteers who was assigned to that home, you know, he was nervous. He hasn't done a lot of media. And so we kind of did some coaching the way we're doing with you guys. And he felt ready. So today he talked to this reporter about his experience with Life Care. And of course, same thing you're talking about, a balance. I mean, try not to just defend them outright, but speak to, you know, some of the concerns that everyone shared about how this got out of control, but also speaking to, gosh, you know, this is, nobody's dealt with this kind of pandemic, you know, really in recent history. And, you know, what nursing home would have, a lot of them would have gone through the same exact thing that Life Care did. So, you know, I think he did a great job with the interview, and I think just getting everyone feeling more comfortable about going on the record with your role as squarely as the voice of residents puts you on pretty safe ground.
Great. So we're heading toward 3:30. So if anyone has any questions that they think of later, you can always email me and I can send them to Kristen so we can talk about them next Monday. So these calls will be every Monday at 3 o'clock for a half an hour. Is there anything anyone else wanted to bring up today just before we close out? And if not, that's okay. We can talk about it next week. Or Kristen, is there anything that you wanted to say?
Yeah, no, that was it. I was going to say next week we're going to focus on that idea of what is your message, what's your core message, what's your kind of COVID-19 message, and how to stay on that message when reporters or circumstances might try to move you off of it, and kind of getting into more of those interview skills and tricks.
Great. Well, thank you. We're looking forward to it, and I'm sure we'll learn a lot from you. So thank you.
Thank you so much. And yeah, feel free to call, reach out. Here's my, I don't know if I'm still on the screen. Whoops. My number, and Katie will get that to you, my number and email. Feel free to reach out anytime.
Yeah, I'm going to send the recording and Kristen's contact information in Friday's email, so you'll have everything. Okay. All right.
Well, everybody.
Well, I'll talk to everyone tomorrow or next week. All right. Bye-bye.
Bye.